two indications that we have right now, which are FDA approved, are for major depressive disorder, which is also called treatment-resistant depression in this instance. What I mean by treatment-resistant depression is that somebody who fits the DSM-5 criteria for major depressive disorder, but has failed at least one medication trial. So that can be either a classic SSRI such as Prozac, or an SNRI like Effexor, or another antidepressant of a different class. So a full trial, meaning 4 to 6 weeks at an FDA-approved dose without remission of symptoms. The other indication, the FDA approval, is for anxious depression. And what I mean by that is patients who also suffer from major depressive disorder, but also suffer from what we would call a Axis 1 anxiety disorder. It could be generalized anxiety, panic disorder, PTSD, etc. But those are the two indications that we have now, and those are the ones that we will be treating. In the future, in a couple of months coming up, we will be using another FDA approval for obsessive compulsive disorder, which is targeting a different area of the brain, which relieves results. Okay, so an initial assessment is done by myself in my clinic. We go through the patient's family history, personal history, psychiatric regimens that they have tried in the past, comorbid medical conditions, any kind of medicines that they're taking currently. And then once the assessment is done and we have all that information collected, we can note whether the patient is a positive candidate for therapy or not. The whole process takes around 6 to 8 weeks, but improvement can be seen within the first 2 to 3 weeks. In the first 4 weeks, on average, you're getting 1 session per day, so 5 days per week. Sessions last from about 18 to 20 minutes, so are not long at all. A patient comes to and fro the clinic. They're able to drive, no medications are administered. Side effects are few and far between. They lack the natural side effects which primary antidepressants such as Prozac or Paxil come with. Most common is scalp irritation, where we place the magnet on top of the scalp where we're targeting the area, and that is transient and is not present after treatment. For repetitive TMS, so deep TMS is what our machine is FDA approved for, basically goes about 3.5 centimeters into the neocortex, and we're stimulating the brain that way using an electromagnet. Response rates are usually in the high 60 to 70%, and remissions are more closer to 45-50%. And these are for patients who have treatment-resistant depression who have failed multiple trials. Patients with co-occurring substance use disorders or personality pathology would not be great candidates for therapy. And the only contraindication to TMS therapy is that we're using an electromagnet. So any kind of metal in the shoulder level or above would be contraindicated because the strength of our magnetic field is equal to an MRI. So if somebody can handle an MRI and their device, wherever they have it, is okay with it, then they're a candidate for TMS.